This is the Art Beauty Podcast where we tell the real truth about the fake shit. I'm Amber, and today my fabulous co-host is the very esteemed Dr. Corey Maas. He is the president of the American Academy of Facial Plastic and Reconstructive Surgery. Welcome to the show.
Thank you, Amber. It's good to be here. Excited to talk to you about this.
I am too. So I was not necessarily surprised to hear, but treatments, facial tweekments, if we will, both surgical and non-surgical, non-invasive fillers and all of that is on the rise. Are you finding that is the case in your practice as well?
Yeah. So as part of the survey that I filled out the survey, of course, to the American Academy of Facial Plastic Surgery, which we run every year as for our 2,200 or so members. And my findings turned out to be very consistent with that of my colleagues. And in the facial plastic surgery area, we're specialists in that. Specifically, we saw increases of 1.4 million cases done, and up of about per surgeon, about 600 procedures per surgeon. So a dramatic rise in the 2020 year of the pandemic. And I'm sure there's a lot of reasons for that, which we'll probably get into. But yes, we're all getting busier, no question.
Well, that is good. And listen, if you at home are listening and you were considering something, really, you are not alone. But before we jump into this, I realize I kind of jumped ahead. Can you tell us a little bit about what the American Academy of Facial Plastic and Reconstructive Surgery is?
So I certainly am glad to do that. The AAFPRS, or American Academy of Facial Plastic and Reconstructive Surgery, is the largest specialty society specializing in plastic surgery of the face, head, and neck. Now, our members do, many of them have med spas and do non-invasive body contouring thing, cool sculpting, and all those sorts of things. But we really specialize surgically in the face. That's our area. 85% of our members do aesthetic surgery primarily, which includes obviously aging face and rhinoplasty and things that help to balance features, rhinoplasty and otoplasty, or repairing outstanding ears or bringing them back closer. The big, and some do more of the rhinoplasty and some do more of the aging face, or if you're like me, it's sort of evenly split. And we have a very eclectic group of both academicians that are in big academic centers, teaching residents, and then we have about 85% of our members are in private practice. Many of us have fellows that are advanced residents, if you will, in training. So that's our group, and it's a exciting and innovative group.
Wonderful. And now every year you do a survey on the latest in these facial plastic and reconstructive surgery trends. So we're going to be getting into all of that goodness today. Let's talk about right off the top. What are some of the most popular procedures that people are going in for in 2021?
In general, I think that people are, what we saw from the survey was that people were going in for a lot of the non-invasive procedures like cosmetic injections, the Botoxins, as I call them, Botox, Dysport, Xeum, and Jeuveau, and there'll be about 3 more of those soon to come out on the market. There are now a number of new fillers that are out there. Yes, there's some, we can talk a little bit about that. We're starting, we run a research center through our practice, or it's a sort of a side of our practice. And there's some new studies going on with some of the newer botulinum toxins. And there's a bunch of very good fillers, but along with that are these non-invasive laser and microneedling and radiofrequency treatments that do anything from skin tightening to improving the skin quality, color, texture, and even lifting indications, which FDA was very reluctant to give any of these devices, the laser devices, any indication that had lift in them. There are a couple that do now have those. So that was where the most expansive growth occurred. But across the board, we saw a 40% increase in rhinoplasty, facelift, blepharoplasty, the aging face types of surgeries, as well as those that involve balancing facial features, if you will. Those that would be like rhinoplasty or otoplasty or cheek implants, cheek and chin implants.
Gotcha. Now, I mean, I remember prior to the pandemic, we were all talking about sort of the effect of social media. And then once the pandemic hit, it was sort of this Zoom effect. Do you feel that more people are going in because they are constantly seeing themselves on video?
Well, the short answer to that is yes. But you set the preface right, because probably 7 years ago I did an interview about what was called the Facebook facelift,
Right.
and it's a little different than now, because that was driven largely where photographs were taken of a group of people. You might have been in that group, and the person taking the photograph, of course, would select the photo that was best for them.
Yeah.
So the other
Uh-huh.
people,
We know how that goes. Yep.
exactly. So you might have been, I don't want to call it a victim, but you might have been an incidental, your image wasn't so good. And that in that particular picture.
Sure.
And so that was an early driver, just the whole idea of our sharing our lives, and that's represented by our faces in particular, with the whole world, was a driver to having people come in and do things to improve their appearance. And when I say that, it's looking your best, I think, is really the main thing that we're trying to do. It doesn't mean we want you to look really different. We want you to look your best.
Right.
Balance features and aging face changes. What's new about now is that it's much more about the selfie. And I have patients that spend a lot of their time and energy and money on making their selfies better, and they can
Right.
control that. So that's a switch that it's certainly driven even more or expanded, much more expansively grown because of Zoom, and everyone's forced to look at themselves all day long, because it's how they're working now.
I mean, I feel as a person who's worked in video for my entire life, I find that video is in some ways way more forgiving than a photo. However, when you are sitting on a meeting for an hour, if you have that thing, excuse me, I'm just going to call it, that is a resting bitch face, you're going to be more aware of that, because it's not that 1 second of just snap and here we go. When we talk about filters too, I've gone into my own dermatologist and been like, how do I look like this? I think that the filters are really interesting, because now with AI, I mean, they can instantly slim the face, change the nose, add the makeup, smooth everything out. Do you find that is kind of, is it a good thing? Is it a bad thing?
Um, I, well, it's interesting thing. I will say that, because it does show people exactly what changes they might like to see to enhance their appearance.
Right.
And so that helps, and if they come in, rather than coming in and asking me or one of my colleagues for a specific procedure, which is not uncommon, they read about some procedure and then they come in and they want to do it. They'll come in with certain changes that they'd like to make, which is a much better approach to coming into the office, because we can really then talk about a number of different options that might be able to get someone there. I
Yeah.
think during this whole Zoom era change, we saw a lot of things that happened because people were looking at themselves, but they also were at home, so they had more time. They had masks on when they were outdoors, so if they had to recover from something, it was we're out
Nobody
of
knows.
society, so nobody really knew unless it was eyes. And eyes were a big deal, because
Yeah.
when you're in a mask, that's really all you see of somebody, so the eyes become even more important. But you couldn't go dining, you couldn't go shopping. Retail was largely closed down. You couldn't go on vacation.
It
As
was a great year to be under construction. 2020, 2021. I know I had some stuff done because, like you said, I could sit at home, I could recover, and then I could drag myself over to my computer without, while I was still in recovery. So it was really great for that. Thank you. Thank you.
Yeah, yeah, exactly. So, and we heard that, and it also resulted in, if you think about how much money would be spent on all those
Yeah.
different things like we just described, there was more, at least in our group, more disposable income to spend on self-improvement. And I do think that all of those were drivers in this. And in many cases, for patients, it was really just getting them on, a really good skincare program, or getting them on a program of some very minimally invasive treatments and skincare that improved, the discoloration, dyschromias of the skin, things like that. And certainly working on convincing them to, and this is not as hard as it used to be, convincing them to stay out of the sun or to use
Yeah.
sunscreen and sun protective stuff. This is really important.
I wear SPF 30 every day. I did a Beauty Pass Live with Dr. Dennis Gross, who you may be familiar with. And he told me that 90% of visible aging comes from sun damage. So for everybody who is listening right now, I currently am also wearing sunscreen. I wear it every single day. Going back to this survey, was there anything that you found on the survey that was sort of most surprising?
Yeah,
Trends,
a couple
treatments being
things.
done? Yeah.
Yeah, I mentioned one. Well, I've kind of mentioned them both in passing. One of them is that 40%, which I think is way up, of patients really want to make sure when they come to the doctor that they're going to the right physician. Are they going to a board certified specialist in the area that's really an expert? And I think that's great. When people ask me the questions, I kind of fall back to the Malcolm Gladwell sort of 10,000 hours or 10,000 reps sort of mantra, that the more you do things, the better you are at it, and the better trained you are, obviously, which goes back to board certification and specialization.
Yeah.
That was a surprise because it's up, and I think in part it's because there's so many med spas and nurses that are going out to their people's homes and the so-called Botox parties and all these things that are happening. That really has driven some more awareness of board certification and the need for getting qualifications of the person. And then the other was the natural look is something that without prompting, patients are now coming in and saying, look, I want to do something, but I don't want to look like a different person. I want to look like me, but just better me.
Right.
And so that's helpful because at least in Northern California, remember, we're not in LA here. So there's drivers down there too, but they are really a little different drivers that are pushing things along. But in general, I think that's the idea. And natural means balanced facial features and things that enhance the natural beauty that everyone has. Everybody's a little different, but we can work toward those goals in a way that doesn't look extraordinary or something where you walk in the room and everybody's
like, whoa.
Exactly. We want to avoid the whoa effect.
We want to avoid the whoa effect, and you want to go with the oh effect. Oh, right.
Yeah,
something looks a little different. You look refreshed.
Yeah.
I know I've been hearing a lot about, and I know that your survey found this, that lip lifts are very, very popular.
Yeah, so that's not new, and it used to be something I had to, and I we still have some difficulty with. I had to convince patients to do because it's really about proportionality.
Okay.
And there's a sort of a misconception out there that if you do a filler, you could have Angelina Jolie's lips, for example, if you start with a very thin lip. And that's just not true because lips are a little bit like tubes. So if you expand them, they're not just getting taller, they're also sticking out farther.
Yeah.
And at some point, the benefit you get in having more vermilion show, more of the red lip showing, the benefit of that is exceeded by how much projection, how far the lip sticks out, this so-called fish lip or trout mouth, or there's other names for it. And so to solve that is very straightforward procedure that we've been doing for many years, which is, and there's different ways to do it, by the way, but a subnasal lip lift where we hide the incision under the nose. Some people do the direct lip lift, not my favorite, but those are ways of getting more of the red lip or the vermilion showing. And then there's there's several lip lifts, by the way, the corner of the mouth lift for the downturned mouth. And so there's a lot of little ways we can do it with very small incisions and disguise it and get better lip proportionality. And then fillers work even better if you still want to have fillers. So it's not that they're one or the other. And these are things that you could literally do in the office, so they don't require high levels of anesthesia or whatnot. Very popular and growing.
Very, very popular. Are there any other, I know there's like a whole new, there's always new technology coming out, but when it comes to laser treatments for things like a lift, what are some of your favorites that are out there right now?
Well, the things that I can say changed the way we practice during my lifetime and career have been, I'll just start with those, have been the Botoxins. And I say that
Right.
again, that Botox, Dysport, Xeomin, and Jeuveau, those are the four that are approved in the US right now, and there'll be more. But those things really change the way we approach people. And then some of the light-based therapies like photo rejuvenation, IPL, some people call it, which
Love it.
stands for
Yeah.
intense pulse light or broadband light, same idea. And that's a crystal that's applied to the skin surface. A very bright flash of light is applied through a gel, and it targets only the pigments, which makes your skin complexion more even. It gets rid of the reds and the browns in your skin. And you can even add to that photodynamic therapy, if you will, where we put a photosensitizing agent on the skin surface first, and that actually gets rid of some of the precancerous changes and shrinks the pores. So those kinds of technologies, which aren't brand new, but when people are coming in for the first time, they're certainly brand new to them, and
Sure.
those need to be introduced.
Yeah.
What we've seen introduced in the last couple of years are ultrasound technologies, including soft wave and therapy, which isn't brand new, which have actually received lifting indications from the Food and Drug Administration, which is a big deal because that language lifting was never given for any of the lasers or some of the RF devices. That a radio frequency is a way of gently heating the skin. RF stands for radio frequency. And but those have grown. The RF micro needling devices have grown dramatically, and we saw a 10 or 15% increase year over year with those devices. And in my mind, RF is sort of a less expensive way of doing non-invasive lasers. Lasers are always going to be more expensive because of the technology. And so microneedling, which is very simple, you're taking a tiny needle and going to a certain depth in the skin. And if you apply RF with the microneedling radio frequency, it gently heats the skin, which stimulates a wound healing and remodeling response where there's new collagen formation and new skin cells that populate the surface, and has very little downtime. That, along with some of the non-invasive lasers, you could say they're really competitors, like Clear and Brilliant. There's a dozen of the
Right.
Resurfix from, I mean, I'm not here to name any brands, and I have no financial relationship, just by way of disclosure. They're all good devices. They work well in the right hands, and they're nice ways of doing minimally invasive improvements.
I'm really glad you said that though, in the right hands. I think that we are bombarded by all of these different procedures. I know that I will get calls. Hey, I heard about this. Is this right for me? Do you think, one, it's important? I know we kind of touched on this before, that you're seeing a 40% increase in people who are looking for more places that they can trust. How can we find the right hands?
Well, that's a good question. I would say a lot of it is about, at least once you've been in practice for a while, most of my patients come from other patients.
Right.
But social media has changed this, where people can instantly be popular based on their skills and whatnot in social media. And so that's where a little caution needs to be applied. And there's some simple questions that any patient can ask when they go to a physician, or even before they go, when they do their research on the websites, which is really what websites now are for, really credentialing the healthcare provider or the physician. Looking for board certification, specifically board specialization, facial plastic surgery board certification obviously makes you an expert in the face. And that's, I mean, just as an example. And then looking at what people are doing and the frequency they're doing it. And I have no problem answering, and I encourage people to ask questions about how many of these have you done? How many have you
Right.
done in the last month? Or how many do you do on average per week? Those kinds of questions are really good questions. And they, you can watch just with body language with the doctor you're talking to about how comfortable they are with those procedures. So I think that the benefit of of like your podcast and the media coming out and educating the public about these kinds of things has been great for those of us who really are specialists and not just, you know, sort of the pop-up social media identities.
And I just want to throw in there, even sometimes when you're going to the best of the best, things can go wrong. What I like about going to somebody who is board certified, especially a facial plastic surgeon, is that sometimes, God forbid, something does go wrong. You're hoping that they can also have the skill set to maybe fix those problems.
Well, that's an excellent statement, and I it's something I have fellows every year, and and I'm also a pilot, so I can tell you that there's a lot of overlap between the two. That's a hobby.
Wow!
Yeah,
Whoa! Very
but
cool.
but it's a hobby that has a lot of overlap, and the idea with this is that as I teach my fellows, it's and residents that I teach to, that is if you're going to have a mistake, you want to make them small.
Yeah.
So there's certain things in surgery that we control, including how we set things up and how we prepare the patient and how we, you know, prep the patient to make sure things are sterile. All those things are under our control. And obviously a fundamental and thorough understanding of the anatomy is key and clear for all of us. And you know, this is where we come with strength. And then there's things in surgery where you can't control them. So in those areas, we want to exercise care, caution, and prudence. I mean, we don't need to be overdoing things or trying to be heroic. If you want a good result, there are certain steps that we take that we know will work, and we want to stay with those. And then we look very carefully. The post-operative care of patients is really an important period of time, pre and post-op, but post-operative in particular, we're looking for little nuanced things that don't look quite right. And if we do early interventions, we can keep what would potentially be a big problem down to something very small and manageable. So it's an excellent question, and it's the same. I mean, I use the pilot analogy because when plane accidents happen, it's not usually because one thing happens. It's a series of things that you weren't prepared for, and those that they build up on one another. And that's if you read like I do about those things, that you just want to keep them small. Mistakes should be small.
Land in the Hudson. Okay. If you got to land somewhere, land in the Hudson, not on a building. Oh my goodness.
You know, and land in the Hudson.
I feel like we, I don't want to sort of give an impression that there is a one size fits all. However, that said, as a facial plastic surgeon, do you believe that some of these treatments that we're hearing about, like the Ulthera, that by starting these maybe a little bit earlier, we can put off that giant facelift that, you know, used to be the only option?
That's an excellent question. And I would, and it's one I've asked myself, and then I've had patients ask me that too. So that's not the first time it's been presented. And the short answer to that is we don't know yet.
Okay.
I can tell you that the response, the variables of response when we talk about these minimally invasive or non-invasive procedures are quite high, unlike some of the procedures like a lift where we can consistently provide a good result that we know is going to be there. With some of these energy-based technologies, and it's really hard to predict. It's not gender or body habitus or skin color or anything else that predicts sort of the outcomes with some of these technologies. And we haven't figured out yet exactly who the best candidate, but typically the patients who have the best results with these treatments would have better results on an ongoing sort of maintenance type of program like what you're suggesting. At the end of the day, I don't think they're ever going to get to the level. No, I don't want to say ever, because who knows, maybe we're taking 20 years from now, we're taking a pill that, you know, keeps us youthful forever. But you know, and stops our telomeres from degenerating at the end of our DNA and things like that, which there is a lot of research in anti-aging, I can tell you that, which is very promising. But whether it delays it though, or pushes that time frame back a little bit, I definitely think that doing things like you're already talking about, and obviously you look very youthful, people that are protecting their skin from the sun are going to age much more slowly. And, you know, that's extrinsic aging. like one of your docs told you. I mean, it's really extrinsic aging are things we can control. That sun damage diet, not smoking and things like that. And intrinsic aging is what we're born with, how our
Right.
genes are sort of programmed. And that's really harder to change. But the things that we can manage the best are working on things that are reducing extrinsic aging forces. And
You know,
again, that's exercise, diet, what you're putting in your body, smoking, and especially the sun. For the skin, it's the sun, sun, sun.
sun, avoid it, avoid it, avoid it. And you're talking to a girl who used to go to tanning salons. I'm admitting it, but
That's right.
don't do it. If you're young and listening to me, please don't do it. Now I go out with SPF like 50 or 60 if I'm at the beach, a hat, glasses, cover up. It's what we got to do. We mentioned before quickly, you touched on gender. Are you seeing that gender gap is sort of closing when it comes? Because I think, a lot more women used to be getting these procedures. Are you seeing a lot more men coming in now?
Yeah, well, for sure. And as if you were to, take half the population, which is the men, by far that group is growing at a exponential rate in terms of coming in and doing things to make themselves look better. And they're doing, men historically have come in, with some other ruse. I want you to look at a skin lesion, and by the way, can you do my eyelids?
Yeah.
Or some, these are the kind of women are much more open about it, and they're certainly much more educated about all these things. But it's changing, and certainly San Francisco is a good example where we have a fair number of men who, identify with the idea of self-improvement and keeping yourself looking your best, and there's really no shame in it. I mean, people are naturally trying to look their best. This is sort of the Nancy Etkoff, the social psychologist from Harvard that wrote Survival of the Prettiest. If you look at her research, I mean, it's very normal and natural to try to look your best, and that has to do with survival of the species and all that. So it's a good read if you're interested in the
Yeah, I would love that. And I mean, we had a couple weeks ago a podcast on about sexual health, which now people are really starting to look at sexual wellness as part of this overall diet, nutrition, avoiding the sun, but that our sexual wellness also plays into it. There was a great study that people who had sexual experiences 3 or more times a week looked 10 years younger than their age. Now, they weren't giving a direct correlation to that. But
Mhm.
I've also read similar studies where people who feel better about themselves, who tend to look a little bit better, younger than their age, are also living longer. So that's,
Yeah, no question. I mean,
when you say no shame in your game, I say live your best life.
absolutely. And I do think, I mean, what plays into that is, keeping moving, like you're saying, exercise, and all of those factors play into the aging process. So, people, and as you see people older and retiring, for example, they've got to have a hobby and something that they're doing to keep them moving. Keeping
Right.
moving is really a key part of staying youthful, and keeping your brain working is another part of staying youthful. So that's in the big picture of youth and health and wellness. I think that's something we all do learn a little bit about, and probably should be learning more about. But what this sort of reset, which happened with the pandemic, has done, is made people a little more self-aware, has given them an opportunity to go out and seek little things that they can do, or bigger things that they can do, to improve their appearance and put their best self forward. And we'll see if that doesn't translate into the post-pandemic, which we're really in the final stages of this pandemic.
Oh,
Into
from
the
your
post-pandemic
lips to
period.
God's ears. I mean, can we just finally end it? They just stopped the mask mandate here, but you know what? I like the masks. I don't care what people say. I haven't had a cold. I've had COVID twice. I've had
Yes.
3 COVID shots, 2 COVIDs, but I have not had a cold in like 2 years. So
Yeah. Well, that's the
here
new
in New York City,
Omicron
yeah.
is very similar to a cold. So if you've had that version, you probably
Oh
know
yeah.
it's like a cold. But I would say the bigger message with that is, and this is sort of counterculture, is that if you don't feel well, you shouldn't go out. You should stay home. You shouldn't go to work. You shouldn't go to school. You should stay home. Parents should recognize that schools aren't daycare centers where they drop off a sick kid, that they need to stay home. And that probably is, if everybody followed that sort of mantra or those philosophies, then we wouldn't have to worry about masks. We would see people out circulating.
Amen to that. See, living in New York City, we are surrounded by people. And I always used to say years ago, there was this mantra, like, if I can physically get my body to work, I'm going to go. And I think now that companies have started to realize, like, that's counterintuitive. We can't do that, because you're really, for the sake of one person, you're probably going to take out 10.
Right.
So I think that is a really good reminder. I hope that everybody listening, if you're feeling sick, stay home. Do us all a favor. Do us all a favor. Let's get back going. And you know what? I want to thank you so much for being on here. There's so much wonderful information. It sounds like, facial plastic surgery procedures, both surgical and non-invasive, are on the rise. You've given us great resources. If people want to know more about you, where should they go?
Well, you can go to my website, maasclinic.com, or drmaas.com is my video blog, but the AAFPRS.org is our organizational website that has a lot of information and a referral base, so you can find a doctor in your area that's board certified in facial plastic surgery. And I just, would remind your audience, and I really very much, Amber, appreciate you having me on, but remind your audience that it's always best to trust your face to a specialist. So that's the main thing we're thinking when we're doing our education and process for our fellows and residents and our faculty. We're always learning as physicians, and our educational programs are there to keep us at our best.
Well, let me tell you, my daddy always said there's two things you don't save money on. That's birth control and plastic surgery. That's not where you want to save your money, right? So thank you for that, Daddy. He's absolutely right. I want to thank you so much, Dr. Maas, for being on. I really appreciate your time. And if you at home are listening and you have questions you want me to pass on to Dr. Maas, I'm happy to do so. You can always reach out to me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and right here on YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday. Bye.